to present about the shoulder anatomy of a human. So the shoulder is made out of 3 bones, which we will take off the outer layer first. As we can see here, I've highlighted the 3 bones are the clavicle, the scapula, and the humerus. We'll start by introducing one of the 3 bones first, which is the humerus. So here are the surface features of the humerus. I would like to emphasize on the greater tubercle of the humerus, as it will be important later since muscles of the rotator cuff inserts into it. It consists of a 3 facet, which includes the superior facet, where the supraspinatus muscle will insert, middle facet, where the infraspinatus muscle will insert, and the inferior facet, where the teres minor muscle will insert. Okay, so the next one is the scapula. This is a 3 view showing the surface features of the scapula. I would like to introduce on the glenoid cavity on the scapula as it is quite important. It consists of a cup-shaped rim made out of fibrocartilage known as the glenoid labrium. It helps to keep the head of the humerus in place. Okay, so lastly is clavicle, aka collarbone. It is an S-shaped bone and is the earliest bone to ossify. It allows movement like climbing, grasping, and manipulating object. It is also known as the commonly fractured bone as it helps to transmit forces from the upper limb to the axial skeleton. It has 5 surface features. It is separated into 3 sections, of which different muscles were attached to it. Okay, enough about bones. Now we can enter the glenohumeral joint. So this is the glenohumeral joint. Its articulating surface includes glenoid fossa, head of humerus, glenoid labrium. Here you can see the coronal plane of the glenohumeral joint. As you can see, the head of humerus is coated by articular cartilages made out of hyaline cartilage. Then there's the dark green layer, which is the joint cavity filled with synovial fluid, and the blue layer is the synovial membrane of the joint capsule. Okay, so we are now entering to the nerve and blood supply of the glenohumeral joint. Up next is the ligaments of the glenohumeral joint, which includes the coracohumeral, transverse humeral, and the glenohumeral ligaments. Going into the bursae, our glenohumeral joint has 5 bursae around it, but the 2 main ones are the subacromial subdeltoid bursae, which is made out of 2 bursae interjoint, and the subtenuous bursae of subscapularis, which is also known as subscapular bursae. Finally, we are going into the muscles. There are 6 muscles total around the glenohumeral joint, of which 4 I have highlighted is the rotator cuff that functions to hold the humeral head in the glenoid cavity of the scapula. To better memorize, one can use the acronym SIDS muscles to memorize the rotator cuffs. So here we can see the origin, insertion, innervation, and action of the 6 muscles located around the shoulders. This includes the subscapularis muscles, the supraspinatus muscles, the infraspinatus muscles, the teres minor muscles, the teres major muscles, and lastly the deltoid muscles. Do note that the deltoid muscles can be split into 3 sections, the clavicular, acromion, and spinal section, of which will carry out different functions. Muscle is also a common site for injection. Glenohumeral joint is a multi-axis ball and socket type synovial joint, thus allowing a lot of movement. Due to lacking any bony constraint, it is one of the most mobile and unstable joint in the body. Coming up next is the shoulder conditions. Now I would like to show a small clip.
Tomorrow I get, but the ref has to see it. The ref now.
So yes, what we saw just now is a great representative of the shoulder luxation, aka complete dislocation. It is the most common type injuries of the shoulders, where the shoulders is flattened and acromion is prominent, making the shoulders to look more square than round. Here, the left shows a normal shoulders and the right shows a dislocated or luxated shoulders. This is the etiology, symptoms, test, and treatment of shoulder luxation. Okay, so the next condition I would like to introduce is the adhesive capsulitis, aka frozen shoulders. It occurs when the joint capsule thickens and tightens around the shoulders, which results in inflammation. Besides that is the rotator cuff tear, which is a quite severe condition that can happen to any of the 4 rotator cuff muscles. Normally, a severe rotator cuff tear doesn't heal by its own due to the tendons being too huge. Lastly is the osteoarthritis bone spurs. This happens when the articular cartilage slowly wears off, leading to the irregular surface exposed. This continues on, which eventually leads to bone rubbing against bone, leading to bone spurs. So this is the end, and thank you for listening.